Good afternoon. What we've been doing until now is saying, ministers, your excellencies, lords, ladies, but I know this session is colleagues. I'm Sally Davies. I have the pleasure of being both the Chief Medical Officer for England, the Chief Medical Advisor to the UK government, but I'm here today leading this session because I'm the Chief Scientific Advisor to the department and I head up the research in the NHS, the National Institute of Health Research, through which we spend £1 billion. So the title of our session today is International Research for Life Sciences and Our Collaborations. And what we want to show you is not that the UK is a global hub of excellence across lots of sectors, you know that. But what we want to show you is how we are open for partnership with industry, but actually partnership with international researchers across the globe. And so, let's see if I can make this work. Yes. We are looking for partnership because we all know that to get better outcomes for our patients, we need to help the life science industries move on from that old pharma model, which is difficult to maintain. We've developed in this country, and we're going to go on working at it, a new focus on translational medicine, early clinical trials with patients, and much more external innovation is helping our pharma companies and the biotech sector go forward. This government, and I'm independent of government, so I can comment on it in my roles, is absolutely committed to creating the right environment in the UK for the life sciences to flourish and be competitive internationally. Indeed, we are trying to develop what's nicknamed around this part of the country the ecosystem that really works for everyone. And last December, our Prime Minister launched the strategy for UK life sciences. This is about stimulating collaboration between industry, our leading universities, and of course, that unique asset, the National Health Service. We've got lots of ideas in Britain. You've heard about some of the old ones that have really driven science and health over the years, but also lots of new ones. We want those early stage British ideas to have a chance of success. And for everyone, we need to move to reduce bureaucracy, reduce barriers, and those of you who were here this morning heard me talk a bit about the Health Research Authority. Through the National Institute of Health Research, NIHR, we are striving to make the NHS the best place in the world to carry out patient-based research. And indeed, I mentioned this morning the legal duty on all bits of the NHS and the Secretary of State to contribute to that by promoting research evidence and doing the research. But last December, at the same time as launching that life sciences strategy by the PM, David Nicholson, the Chief Executive of the NHS, who you met this morning, launched his report, Innovation, Health and Wealth. And he's absolutely clear that while we're making good progress with clinical research, we need to do more about picking up innovation, diffusing it, scaling it. And there's a lot of work going on about that. We do have an exceptional research base. I'm very proud to be British when I look at this, among other things. I was very proud with that opening ceremony that showed the NHS as rather old-fashioned nurses, too. It's a wonderful place to be at the moment because of the buzz based on that active science going on, and I'm not going to go into the detail of that. If you look at our research in context, what you'll see is we punch above our weight, and one metric here is NIH grants awarded outside the US, and the other is European grants awarded, and we've been given in the UK over 500 million euros through FP7. So we're working to make this UK environment ideal for everyone. It's a unique research ecosystem because the government has invested not just in universities, not just through our medical research councils, but also through the Department of Health and the NIHR, £1 billion to bring the NHS into this triple lock of everyone working together in the interests of research for patient benefit. We have the most integrated health research system in the country, and the research investment in infrastructure is dramatic and very exciting, so that we now have, through NIHR in the NHS, overlaid on the NHS, a unique asset in the NHS. And one of the translational medicine activities is £800 million given to partnerships between the NHS and academic institutions, our biomedical research centres and units that we're very proud of. They are at the cutting edge with wonderful infrastructure, great partnerships, many patients to call on to pull through that excellent fundamental biological discovery that we have and some engineering into the clinic. They're strengthened by a whole network of clinical research facilities around the country. And all of this infrastructure, as it's put in, is competitive. And we've been rerunning the competitions, and some who had money have fallen out. We're making sure we fund the best so that you can work with them. You're going to hear from 3 of our key researchers today from these expert sessions. They all work in biomedical research centres, and they are at the centre of the cutting edge of science. And here you see something about gene therapy, and from Moorfields Hospital, and Professor Peng T. Kaur will talk to that. Our Prime Minister wants us to be open for business. You've heard that. He has one major research priority that we are also working on, and that's dementia. We've got a unique environment here, not only that excellent science and that partnership across the public funders, but also the charities such as the Wellcome Trust and other smaller charities work with us. We're all facing the same way, and we are intent upon making the UK a flagship for dementia research. Indeed, the government has just doubled the funding going into dementia research, so that we've got well-established research infrastructure to pull through the science from the excellent basic science. And some of you will have seen in John Bell's session earlier the King's College example of beautiful imaging for dementia. We've brought together our biomedical research units and those interested in this area with expertise as a dementia translational research collaboration to work with industry, and it's easy to access that network, that collaboration, through the NIHR Office of Clinical Research Infrastructure, NOCRI, that was mentioned earlier as well. And we're joining that up with our managed clinical research network for dementia and neurodegenerative diseases, which has got a strong track record of delivering patients through studies to time and target. Indeed, over the last 6 years, that network in dementia and neurodegenerative diseases has put more than 13,000 patients over the last year into studies. We're going to do a half day on October the 11th of our offer to industry in the field of dementia. So if any of you are here from industry and you would like to come to that, please tell Mark Samuels, who's going to stand up now, so you know who he is and who to tell. But in addition to the dementia challenge, I just want to finish by mentioning how we're trying to develop our data resources. The NHS has a unique identifier for every patient. We've got 20 years of experience of handling very large data sets, and now we're investing over £60 million in order to develop the Clinical Practice Research Data Link, CPRD, to bring together the data, link it, and anonymize it. This service is now open and is starting to do studies for people, both academic researchers and industry researchers. It's already making an impact. We've recently done a medical devices study, which couldn't have been done otherwise without a major prospective registry, and it showed that a prosthetic device is safe, though there had been concerns. We were able to show it was safe. We also have, led out of Cambridge, through the biomedical research centres of the NIHR National Bioresource, which enhances capability to study molecular basis of disease. So we have a lot of infrastructure that is state-of-the-art to facilitate collaborations with other researchers and with industry, and it builds on that unique asset of the NHS partnered with academia. So I'm now going to introduce our first speaker, Simon Lovestone. He's professor at the Institute of Psychiatry and Moorfields Hospital. He belongs to King's College London, and he is the director of our translational research collaboration for dementia. So Simon, over to you. Thank you.